Hey guys, welcome to the Dr. G Show. So today this is episode 402, and we want to talk about can you reverse type 2 diabetes? So this is a very important topic because this is affecting so many of our friends and family and people in our community. And the short answer is absolutely. So again, for 20 years, that's one of my favorite things. Patients come in with type 2 diabetes that's just unmanageable, all the way to the point of unreadable A1Cs, which we'll talk about on case studies or grand rounds presentations. That'll be one of them. And the problem with this is we're needlessly suffering and dying prematurely from something that actually can be easily reversed. So when you look at Americans consuming 170 pounds of added sugar to our diet, we went from 0 to 10 pounds a year by 1990. And that's where we started seeing a sudden epidemic of obesity, but then the skyrocketing of type 2 diabetes and weight gain and heart attacks and dental fillings and all that stuff that came with it, right? So Americans are now consuming 170 pounds of added sugar to our diet. Interestingly enough, the average woman weighs 177 pounds now. So literally women in America are eating their entire body weight in sugar every single year. Well, that's in 50 different forms. So again, a lot of times we don't even see the sugar that we're eating. It's listed as different names. So like dextrose, dextrin, maltodextrin, glucose, I was saying galactose and mannose and all those kind of things, But there's like 50 different sugars that we go through with our clients and patients. And because of that, we now have 1 out of every 2 Americans is either full-blown type 2 or will be within 3 to 5 years, which is insane, going from 0 to pretty much half the people are either already or will be within 3 to 5 years. So that's pre-diabetes, which we'll kind of touch on a little bit. To me, it doesn't matter. The fix is the same for all of it. And that unregulated blood sugar is going to damage all the tissue from the heart to the kidneys to the eyes to the nerves to losing toes in your feet. And this is a personal one. My dad was type 2 diabetic. I loved going to his house during the summers because he had just cases of soda in the garage. Like it felt so rich because we grew up poor. And you just drink unlimited soda, and he had just unlimited food in the fridge. But he was so overweight. Like he used to be super athletic, super healthy, and then he jacked up his knee jumping a fence based on a dare at a party, and didn't work out so well. So then he couldn't walk very well for quite a while, and he ended up gaining a bunch of weight, and then of course it just went downhill from there, like most people would. And so my dad lost his toes, then lost a half a foot, then the other foot, then below the knee amputation, then above the knee amputation, eventually through a clot and died. But he did all that in his early 50s. And so I've outlived my father at this point because I choose to eat and live a different way based on knowing this stuff. So just because it happens in your family, just know it's not a death sentence. Okay? This is a sudden epidemic, which means we cause these, which means we can reverse these. So the westernized management of this, again, we have medicine, which is global, and then we had synthetic medicine from the 1900s, or a little bit before that, but that synthetic medication from Dow and Rockefeller and all that. That created a whole different industry and approach to treating people. So that westernized medicine approach really is just give people synthetic drugs for the rest of their life. Don't change what they're doing. And then they're still going to have complications and side effects, but we'll just give them more medications until they end up dying prematurely and really very quickly because of that. So long term, we just are designed to prescribe and just monitor lab values and never address why we got it, how we're going to fix it, how we're going to prevent the rest of the family from ever having it. Now, there's a long-term medication consequence from this, just like we talk about with Crohn's and everything else. But there's also a huge financial burden to this. And so, in the meantime, chronic advanced glycation end products, uh, they end up damaging the tissues, leading to cardiovascular disease and the strokes and amputations that we see. So, that myth that we all are taught in America with this new sudden epidemic of pre and post diabetes is that it's a lifelong chronic illness that you can only manage. But I'm telling you, that is not true. So, conventional expectations basically is only framed as chronic disease and just medication monitoring, escalating treatment, and then amputations. So, we want to break away from that model when we talk about functional lifestyle medicine approaches with this. So, talk a little bit about the kind of pertinent data right now, right? So in the 1900s, the number of diabetes type 2 was 0, right? You couldn't cause a sugar storage disease because we really didn't import added sugar until about maybe the early 1800s. And then again, by 1910, we were consuming about 10 pounds of sugar in a year. Now, 1960, just 60 years later, it was 1.6 million Americans, right? So 1.6 million by 1960. We started importing a lot more sugar. That escalation went up very quickly. And by 2023, it's 40 million with 11 million undiagnosed. And then the other huge portion is the pre-diabetes, right? So we have more obese Americans than overweight Americans. 80% of those will be type 2 diabetic within 3 to 5 years, meaning about 1 out of every 2 Americans is either full-blown type 2 or will be within 3 to 5 years from a disease, again, that never existed before, right? Now, type 2, there's type 1 diabetes. We'll talk about reversing that. We teach that in our functional lifestyle medicine program, mentoring functional medicine, and then we also occasionally have patients that come in or clients that come in over the years that's our goal, is to teach them how to reverse type 1. So we've had clinical success with that because it's just autoimmune. Now, that being said, 95% of all diabetes is going to be type 2. Now, there's also type 3 diabetes, which is the same thing, but really focused on in the brain, which we'll talk about on another show. There's also 3.5, there's 4, and there's type 5, which is junk diabetes. So we'll go through those later. But for the most part, pretty much all of them, except for type 1, we're going to fix the exact same way. Type 1, we just do through treatment autoimmune, right? So that's easy enough. Now, I do like type 2 diabetes because type 2, type 3, 3.5, 4, 5, it's all the same, right? It's very simple to actually fix this. Now, the medication burden, oh yeah, just jump on the medication right away, right? That'll solve all your problems. So one of the medications that they typically give is metformin. And metformin is basically going to help force sugar into cells that don't want the sugar. So diabetes is a very easy explanation. It's a very easy explanation to reverse it. But basically, you just have too much sugar being forced into cells that don't want sugar. And eventually we lock doors or basically downregulate receptors. Then more sugar builds up in the hallways because we can't put them in the rooms. And then that means high elevated blood sugar on a test. But then they give them medication that will just force more sugar into cells that are already full of too much sugar because we eat 170 pounds of added sugar. So that's not very good. That's not fixing anything. The minute they go off, it's usually worse. But the long-term consequences of that is people have upset stomachs because of that. You have maybe lactic acidosis as a rarity for that. But the big main problem is B12 deficiency. And B12, which we talked about reversing Crohn's, is a critical thing, not for just methylation of DNA and changing and reversing mutations, but they run a pathway from homocysteine to folate to bioterapin. And then that is what becomes the precursor to making glutathione to detoxify these medications through your liver, but also bioterapin through the eventual third pathway here from B12 is what then converts amino acids into hormones like melatonin, serotonin, PEA, thyroid hormone, octopamine for your behavior and mood, and then dopamine, so you just feel happy and peace, and then a little bit of epinephrine, norepinephrine before fight or flight. It's just drive. It's just, I'm effective and I get stuff done. But all of those quality of life hormones and neurotransmitters all are predicated on bioterapin for converting, which is predicated on folate, which are methyl tetrahydrofolate reductase mutations, can be problematic with that, but that's another episode. But that's all predicated on just getting your methyl B12. And so not only do we have this problem with proton pump inhibitors, getting rid of the acid and the intrinsic factor, so we can't even absorb the methyl B12, but now you're taking a medication that actually interferes with the absorption, so then all of those quality of life functions disappear. So great, your blood sugar looks better on a lab because you're forcing more sugar into the cells, and now your quality of life sucks. So that's not helpful at all, right? There's sulfonylureas. Now, they often lead to hypoglycemia, but also weight gain, which is a big problem because that's part of the problem in the beginning. And then we have other medications like DPP for inhibitors, SGLT2 inhibitors, and then both of those, like the DPP4s, they're generally well tolerated, but they end up causing pancreatitis and severe joint pain, so they have got warnings about that. So great, your labs look better, but now your joints hurt, and you're going to die pretty quickly from pancreatitis, because once the pancreas becomes inflamed, leaks digestive enzymes into your tissue, you digest your own tissue. So that's not a good long-term solution, right? There's GLP-1s. Oh my gosh, like that's the big new thing, but that is from lizard spits. And basically, if you make out with a Gila monster, it makes your tummy upset, and we call it GLP-1s, glucose-like protein 1. But that's not exactly how that truly works. It's more likely, and then Dr. Kessler was talking about this, who wrote The End of Overeating years ago. He was in charge of our USDA program back a few administrations ago. But basically, the real outcome is it upsets your stomach. And if your stomach doesn't feel good, you don't eat. And if you don't eat, you lose weight. And if you stop eating a bunch of sugar, well, then your blood sugar is going to get a little bit better. But what happens if you stop kissing lizards? Well, 2026 research came out that I put out on my Facebook. This was in January that it came out, and I put it on my Facebook on February, that basically said the same things Tufts University has said forever for weight loss programs, is that 100% of people that quit taking their GLPs will gain all their weight back, and the expectation is with 50% more. Because now your metabolism's lower and you go back to eating the same exact way that you ate before to cause the obesity or type 2 diabetes. So now you're just going to gain weight faster. So that's where, again, we see every weight loss program in America. It's just fail, gain more weight, fail, gain more weight, fail, gain more weight, and then eventually give up. So Tufts University says that there's 4 major outcomes or expectations to all weight loss programs in America, now including GLP-1s. The number 1 is the majority that start any weight loss program, anything, Weight Watchers, the cookie diet, GLP-1s, will quit because it's hard, right? And again, a lot of people are quitting GLP-1s because it makes your tummy hurt and nobody wants to just feel awful all the time. So then they just go back. Now, that's the number 1. Most people will never stick to a weight loss program. Again, we're dealing with morphine from cheese and wheat and meat, so it's hard. Now, the second most likely outcome is that the majority that stick with a weight loss program never actually lose any weight. And that's, of course, because you can eat 170 pounds of sugar and gain weight, But your liver actually makes sugar from scratch called gluconeogenesis every time you're stressed. So that way you have lots of energy for running away or punching somebody, or, a little both, right? But now your blood sugar's just jacked up all day long because you're watching the news and you're worried about the aliens and the immigrants and the Iran war and like every freaking thing that doesn't matter for your actual life. You're just stressing about it every single day, and now you're diabetic. So, or sabotaging your weight loss program. So all that fear-based, inadequacy-based, things that you can't control, all that stuff that you're worrying about is literally sabotaging your diet. So eat sugar, make sugar, the body doesn't care where the sugar comes from. Now, the third most common outcome for weight loss, and again, this is playing just the same as diabetes, is that the majority who actually stick with a weight loss program and actually lose weight, pretty much no matter what they do, it's about 40 pounds. So about 40, no matter which diet you do, because they're all end up calorie restriction. But the most important thing is the fourth major outcome Tufts University published was that if you did stick with the diet and you lost your 45 pounds, most of those people will gain all that weight back plus 50% more within 6 months of quitting, because again, they never changed why they gained weight in the first place, became diabetic or obese. So our treatment for that is a multi-billion-dollar industry to manage, not to fix, not to reverse. Nobody wants a cure-all for weight gain in America. They want you to fail and try the next thing and fail and try the next thing. So we just do gimmick after gimmick after gimmick until people finally give up. So the other thing is insulin, right? I mean, insulin was this great thing. It was derived from, I believe, pigs, right? Pig thyroid? Or sorry, pig pancreas. And it was supposed to be free for everyone, but of course that's not true. But insulin is what binds to your sugar to then basically trigger the receptor to then force sugar in, which doesn't really, again, make a big difference as far as like reversing anything if your cells are already packed full of too much sugar. So how long can you eat 170 pounds of added sugar in 50 different forms and just keep taking insulin to force the sugar in? There's a consequence, and insulin itself is actually inflammatory too. So then you start seeing these really kind of frustrating ranges, and just people are not reacting the way they should, and they just end up being too low, too high, too low. So that we can't even out these spikes like we like. So long-term medication it's not helpful. So that's an option if you don't want to fix it. So the major complications is while you have these spikes up and down, you also are going to have complications from those. And insulin's inflammatory, but sugar's highly inflammatory. And that sugar floating around causes advanced glycation end products, or AGEs, ages you, right? And then that increases cardiovascular disease. If you have blood sugar issues or diabetes type 2, your risk of cardiovascular disease increases by 100%. 100%. You are double the risk of everybody else. With kidney disease, that's our other one because, again, capillaries are very, very fine blood vessels, only one cell thick, to then blood pressure pushes extra fluid out, collects in your kidneys, and then you pee it out, right? Well, if you damage that tissue, now you have kidney filter problems. And so then you're going to get congestive heart failure, that kind of stuff. So cardiovascular disease ends up leading to kidney disease. And then kidney disease, if you're type 2 diabetic, you're 100% more likely to have a kidney disease from that. I used to practice in a little town called Newton. We had 3 dialysis centers there, right? I mean, when your kidneys can't function anymore, you have to go at least twice a week and go for, I think, 6 hours and have your blood cleaned up because your kidneys aren't working. But 3 in a little town, that's crazy. But that's, of course, half that town is diabetic, of course. So maybe more. So you are twice as likely, or 100% increase of kidney disease with type 2 diabetes. And in fact, 1 out of 3 adults with diabetes already have chronic kidney disease. So that EGFR just gets lower and lower and lower. And in fact, because so many people have hyperperfusion of their kidneys, the new normal for EGFR, or estimated glomerular filtration rate, which is kind of how well your kidneys are filtered, is 60 to 90. But 60 and 90 is traditionally stage 1 kidney failure. But because everybody has stage 1 kidney failure, they're like, normal now? So 90 to 120 is optimal. That's your functional range. That's your goal. So they just kind of let you go down and down and down and down and down. Just taking your medication, eating your American diet, and then eventually they don't care because we're going to put you on dialysis to make more money. So, can't function without your kidneys. And then neuropathies are probably the ones that people know about the most. I mean, basically, you just get numb feet, numb toes. People step on nails, get ulcers, and then they lose their foot, right? So neuropathies are nerve pathology or nerve damage. 50% increase, which I thought that would be way higher, but it's just high. The others are way higher than that higher, so it kind of offsets a little bit. But roughly about half of those with diabetic will have some form of nerve damage. Usually lower feet, usually toes, but it can be hands, neck, anywhere, right? So especially as you damage the blood vessels to the nerves, then the nerves end up dysfunctioning. But you can also then damage the nerves specifically and have frank pathology of that. Now, vision is one of the worst parts of this. And your eyes are very delicate. You have the back of your eye and the front of your eye and the middle of the eye and then the lens. And all of those are susceptible to oxidative or reactive species damage. So that's where, again, where we see like black tea is oxidative or green tea is antioxidant for the eye. But because the blood sugar causes that advanced glycation end product, it damages the fine tissue. So then you end up with visual problems, so retinopathies and glaucoma and cataracts. So 1 out of 20, about 5% of all the diabetics, but 1 out of 20, that's not rare, are going to end up with visual disruptions and eventually blindness. And then with feet, more than fingers, but feet, because it's as far away as you can get from the heart. About 1 out of 4, or 25%, with neuropathies, or will have neuropathies in just the feet. So what did we say? 1 out of 2? Let's see, 50%, half. Yeah, so 1 out of 2 will have neuropathy, but 1 out of 4 will have neuropathy just in the feet. 1 out of 3 will end up with ulcers on their foot, and then serious infections will increase, and then there's a 900% increase in amputations if you're type 2 diabetic. So again, much like my father, losing a toe and then half a toe and then half foot and then half a leg, it just keeps escalating. I had one client come in years ago. He's a farmer, and he has missing a foot. He had a little robot foot, and then he had a half leg with a robot leg there. And he was just telling me how I didn't know what the hell I was talking about, and diabetes can't be reversed. And that dude died I don't know, next year, maybe, I think it was the next year. But I'm like, dude, if you're losing toes and feet and legs, you're this close. But he didn't care. So the complications of not reversing this or just chronically managing this, because again, all these major complications are people that are managing their diabetes. Those spikes, those forcing sugar in the cells that don't want sugar, there's complications to that. There's a price we pay for that management. Now, the burden of this, basically, I don't really care about all the billions for the U.S., but for the average person, it's about $12,000 to $20,000 of direct and indirect medical costs for that. And so lifetime costs vary substantially because it just depends on where you get it. And it used to be you had to be 35 years of age. Like we keep changing the diagnosis, right? Or the criteria. Back when it first started, it was adult onset, non-insulin dependent type 2 diabetes, right? So you just managed it with food. It's caused by food, managed by food. And then we created, but it took 35 years of overeating to even get to that point. Then we created type 2 diabetes, adult onset, insulin dependent. Now they were eating so much sugar that they have to have insulin to even get that blood sugar back down to the satisfied amount. Then they came out with pediatric non-insulin dependent type 2 diabetes, which was insane because how do you get a child to end up with so much sugar saturation into their cells that they are desensitizing the receptors and creating this type 2 diabetes? But, what? Average 15-year-olds get half their daily calories from one food. Sugar. So, yeah, that makes sense. And then we came out with pediatric onset insulin dependent type 2 diabetes. So now even the kid can't even run this off or change their diet enough that they're so screwed with their American lifestyle that they end up have to have insulin for this. And then we have type 3 diabetes, which was brain diabetes, because the brain runs off sugar. And so if you have too much sugar, then the body downregulates the receptors, and then your brain doesn't work, and then we call it Alzheimerism or dementia, basically metabolic dementia instead of vascular and neuropathic. So that's great. Now hopefully we'll get to, or infant type 2 diabetes. I mean, I don't think we're far off because when I did pediatric rounds at Cook's Children's Hospital down in Texas, and this was a long time ago, but there would be moms that bring in their babies with these extra large baby bottles full of Dr. Pepper. And they would bring their kids in and you're just like, what's in there? And they're like, oh, it's Dr. Pepper because it's really hot out. And, we got to keep this baby hydrated. Holy crap. You're giving that baby almost 130 grams of sugar, to which it was never designed to get 130 grams of sugar. I mean, adults shouldn't be drinking. Like, if you drink one soda a day, which is 25 teaspoons of sugar, right? I think 65 grams, if I remember right. One soda, that much sugar, makes you 80% more likely to be type 2 diabetic. And you're feeding a baby double soda, and they're this big. Holy crap. So don't be, surprised if we don't end up with infant type 2 diabetes. So, America. This is so crazy, y'all. Like, I love my job, but man, like, we never sit back and go, I think this is enough. I think we should probably, cancel the game and start back over, right? Like, this is crazy. There's the documentary Fat, and in there, I like this one woman. She works at a diabetic clinic, and she said, we now have teenagers getting type 2 diabetes and 20-year-olds getting amputations and 30-year-olds dying from heart attacks and strokes because of this. She's like, at what point do we decide this is enough? Like, this is just too much. I mean, kids getting amputations, well, that's just crazy. But because it happens so much, we're like, yeah, that's normal. It's fine. It's America. But at some point, it's got to be unacceptable to y'all. For your family, your church, your community. Like, at some point, collectively, you have to be like, we're not going to have this. So, watching my dad die and do all that stuff, I was like, I'm not doing that. So, I'm going to make different choices. And then my children eat radically different than I grew up eating, right? So, and then also baby food. We'll talk about that at some point in another show. But just know baby food is instant sugar. It's just all sugar. So then what does the toddler want? Sugar. What does the kid want? Sugar, right? Just instant sugar is what we create. Where you really should be mama birding it like everybody else in every other country, where you're feeding them spices and flavors, the same as the adult would eat. And so then they grow up craving flavor, not sugar. So that's a whole different discussion. We'll talk about that. So annual costs, and then lost productivity. So people going to get amputations, going to the hospital, having surgeries. I mean, you're still up around $12,000 to $20,000 for that. So, and then long-term physical consequences, of course, insulin resistance, then compensatory hyperinsulinemia, which then reactive hypoglycemia, and then progressive glucose dysregulation and advanced glycation end products, then chronic hyperglycemia, then vascular neuropathy injuries. Then it starts destroying the brain, the heart, the kidneys, the eyes, the nerves, and the feet. And then people learn that it's reversible and they should be pissed off because they didn't have to tolerate any of this stuff. You save so much of your health and time and energy by not having type 2 diabetes. But none of your doctors are going to tell you it's easily reversible. In fact, when I was lecturing years ago for the postdoc program, my textbook of, was it Greenspan? Greenspan's Basic and Clinical Endocrinology by Lang, it says type 2 diabetes is reversible. The American Diabetic Association says there's not. We got to raise money. We got to keep fundraising. We're going to find this cure. But the textbook says you can, right? But most docs are not going to be taught that. So you're only chronically sick, dying prematurely based on what your current doctor doesn't know, mainly about lifestyle or nutrition. So all that being said, right? We have a different clinical approach with this. So the way we're so successful with reversing type 2 diabetes and so quick is understanding what causes this, right? You can't eat 150 pounds of added sugar. You can't be stressing out all the time, and you can't be managed that and having a bunch of chemical toxicity. So even simple things like synthetic sugars derived from formaldehyde actually make you fatter and more diabetic than if you just ate the sugar. So the chemicals that we use often are sabotaging our progress there. So we go through this functional lifestyle medicine protocol, which is just changing your food, changing the chemicals, changing the chronic stress. So then we stop overburdening the receptors. The receptors will start to come back. We have to do what's called aerobic glycolysis and basically creating purposeful movement to where you're burning off the stored sugar. So once you stop bringing in 170 pounds of added sugar and you start burning off the stored sugar, suddenly your body will resensitize to these insulin receptors. And then all of a sudden you burn and replace and burn and replace, and then you lower your glycemic index within your blood, and then all of a sudden you're not diabetic anymore. So diabetes is not a disease. It is an absolute normal expected outcome from an abnormal diet and lifestyle. How much sugar can you consume before the body can't store more sugar? So once we make these systematic lifestyle approaches or changes, we also kind of want to test, and usually A1C kept changing. So it went over the years from 7 to 6.5 to 5.7, back up to 6.5, then back down to 5.7. And now they're going to lower it to 5.4. Really just get people on medications earlier. Even fasting blood sugar went from 120 to 110 to 100 to usually about 99, maybe 95, but they're lowering that too. But it's just to get people on meds earlier. They're just like, well, we're all going to be diabetic, so let's just put you on metformin earlier and mess up your B12, and you just deal with that. Now, we want to monitor A1C. Now, the nice thing is, before A1C, that's 3 months of glycolated red blood cells. And so we, again, teach that in the Mentoring Functional Medicine program. But now they have the continuous glucose monitors. And, they go on the back of your arm. They're great. You can see on your phone constantly what your blood sugar is. But really importantly, I like it because you could actually see when I eat this food, what happens to my blood sugar, right? So I wore one of those for I guess last month or a month before. Hummus. Of all things, hummus made my blood sugar just spike up like crazy. I would have never expected that. Corn chips. Again, organic corn chips. They're blue. They have sea salt. Like, they should be fine, right? No, they just jack my blood sugar up like crazy too. So again, you have somebody eating corn chips and hummus, and you're like, "Hey, you're doing good. It's not sugar, but it jacked up blood sugar like crazy." So I'm still not sure why the hummus does that, except for maybe the carbohydrates in the chickpeas or something. But I don't know. So, and I really thought there'd be enough fiber in the corn chips to maybe offset the sugar in the corn chips, because all carbohydrates are just sugar bound to oxygen bound, sugar bound to oxygen bound, sugar bound to oxygen. So all carbohydrates break down to sugar, but if you have fiber, it absorbs 80% of that sugar, feeds your gut bacteria, fructooligosaccharides, lowers your blood sugar, makes your gut healthier, you reverse DNA mutations, everything's all great, right? But apparently there's not. It's so overly processed, it's just sugar. So watching the blood sugar, and there were some things that I ate that I really thought would spike sugar, and it didn't. It really didn't. I was really surprised. So the continuous glucose monitors, like if you don't do insurance, they're only like $50. You can get them on Amazon. So it's like $50 for a month or two, and they eventually the seal comes off because your skin cells are replaced and it'll fall off. It doesn't hurt or anything. And you just don't notice it's even there, but man, watching your glucose is great. So that has been a real blessing because you don't have to wait 3 months to see how well you're doing with these people. You can just constantly have them self-aware, right? And then, a basic CBC, CMP, what is their blood cells doing? What is their blood sugar, fasting blood sugar look like? But mainly, what does their kidneys look like? What does their liver look like? And then what's their urine output look like? Are they leaking ketones? Are they leaking proteins? Like, what kind of damage are we looking at? And are we seeing it reverse? Now, the other nice thing, too, is maybe looking at inflammatory markers. And so, again, since there's such a risk for heart attacks and strokes, maybe a homocysteine, a cardio CRP, or a HS, high-sensitive CRP. Like, those are good monitors to see what kind of cardiovascular damage is being done. And then we want to really focus on reversing that damage, right? So, don't worry about LPA and ApoB100, and those are genetically upregulated with inflammation to make small, dense lipoproteins, or LDLs, to fix damage. So again, you don't want to shut off cholesterol that's repairing the damage, that's saving your life because you're eating too much sugar. You want to stop eating the sugar, right? So fix the problem, not the people trying to fix the problem in your body. So basically monitoring, we kind of prove it out real fast, and then people feel really good about that. And then again, this simple approach with functional lifestyle medicine, we don't do gimmicks or any of that kind of stuff. I mean, you can do vanadium, chromium, you can do natural GLP-1s, you can do cinnamon, but again, none of those are reversing the actual problem. So we don't want even supplement management with this. We just want stop causing the problem. Genetically and physiologically, you're designed to restore back to normal. Then deal with the inflammation outcomes and reverse that as best we can so that you don't have the heart attack and stroke, and then your kids are different, and then their kids are different. And you create a legacy where you get to watch all your friends die first. So now, 20 years, 95% success rate. I would say diabetes, we're probably closer to 100% on that one. We even had a patient, the worst one ever. They came from Oklahoma. She was like, "Oh, my sister's going to die. Like, she's just going to die. She can't survive like this." Her A1C was unreadable. And I didn't even know the people had blood sugar so high that we don't even make machines to read that high. So she started out unreadable, but within a few months, she was normal fasting blood sugar, no medication. So basically our take home from this, right, is type 2 diabetes is highly reversible in just a matter of months, which is great. And so basically understanding the physiology, the pathophysiology, and the restorative physiology allows physicians that do this work to really just change your life. So, all right. So if you know anybody, make sure to like, subscribe, share. This is half your church, half your family, half the neighborhood, right? But make sure to like, share, and subscribe. We are coming out with tons. We have like 32. We have 32 more Dr. G shows for this season. So lots and lots of shows. If you want to show on something different, let me know too. So last week we talked about Crohn's, reversing that. Today we're talking about reversing diabetes. Next we're talking about the hidden causes of pain. That's going to be a really good one. And if you're wanting to reverse your diabetes or kind of like tell someone they can do it, you can visit genomicwellnessgroup.com. Let them know you're from the Dr. G show. They can get 50% off their consult. And then for doctors, nurses, health coaches that want to learn how to do this practice, learn functional lifestyle medicine, or really just how to reverse all this stuff so easily, we have a 300-hour postdoctoral diplomate course, and that's at mentoringfunctionalmedicine.com. And then we also have it all in school, which we'll link to. And then watch for our weekly webinar series. So every Friday we're having a webinar. We're going to be a little behind trying to get caught up with the whole process of recording and putting it on our podcast. But look out for that. And then we also have our Grand Rounds cases. So each week we're also going to present case studies of really interesting, unique cases and kind of talk about our Grand Round presentation for each of those. So we already did the girl that sweats blue and then 13-year-old with reversing Crohn's last week. So watch out for that, and then follow us on those. And again, thank you guys. 10 years of doing this. Man, I really appreciate you guys. So let us know if we can come up with better stuff that's more meaningful for you guys, if you have something unique. Thank you guys. Bye-bye.